Okay, good afternoon or good evening, everyone. Good to have you all here. Thanks for joining this session. It's my pleasure to welcome you all. Uh, and thanks for making time for joining today's session on digital health reforms in India and the evolving role of medtech industry. Uh, so, since you're all our members, this is a members-only event. All of you must be knowing that we have a very active digital health committee in the region, and this is an initiative that is being run by that committee. In fact, we have a India COE, Digital Health COE, which we established earlier this year, and this is one of those initiatives that we are launching under the aegis of that committee. Uh, so, before we get started, I would like to briefly introduce some of our speakers, but maybe before that, just a few housekeeping items. So request you all to be on mute. I think you're already on listen-only mode, but we definitely would have some opportunity during the presentation and even after that, where we would like you to interact and share some of your questions that you would have for the panelists. We have some experts on board today, so do take this opportunity to ask your questions. Also, this webinar would be recorded, and in case after the webinar, if you or your colleagues would like to access the recording, we would be providing a link for you to do so. So those are a few things that I thought I'll share with you. The agenda is coming up. So this is how we plan the next 1 hour. So we start with the priorities of the region, which Roberta will share. The landscape of India, which Lalit would share, and then we'll move into the newer opportunities and engagements, which Dr. Pankaj will share, and then we'll keep some time for Q&A. We also have Shweta, who is moderating the session, and will be interacting with you and the panelists during the course of this 1 hour. So, quick introduction to our experts who we have today. So maybe I'll start with Dr. Pankaj. So, yeah. So we have Dr. Pankaj with us, who is a digital health transformation leader and currently heads Access Health Digital. He is a technocrat with masters in computer science, bioinformatics, and management, and over 2 decades of experience working in the healthcare pharma technology business and process standardization. A visionary leader in the digital health space, he has been working on many healthcare policies with government, including NDHB, MDDS Health, NIN Facility Registry, PMJ, Ayushman Bharat, among others, and is also a consultant at the board level of several healthcare funds and large healthcare organizations. Dr. Gupta started with running his own primary healthcare clinics for about 8 years before getting into the healthcare leadership roles globally. So thank you very much, Dr. Gupta, for joining us today. Next, we have Lalit Mistry. Lalit is the director with the healthcare team at KPMG India. He has over 17 years of experience working in India, Kenya, Singapore, and the Middle East with a range of governments, hospitals, medical device companies, health insurance providers, and international development agencies. His core area of work includes public health advisory, PPP, healthcare infrastructure development, strategy, operations improvement, due diligence, project management, and health IT. He has been working together with KPMG Global Center of Excellence for Universal Healthcare Coverage to drive UHC agenda in India and across central and state governments and other stakeholders. He currently leads KPMG's support to India's flagship national health insurance scheme, Ayushman Bharat, across 4 states of India. Thank you, Lalit, for joining us today. And welcome to the session. Our next speaker, who is also the moderator for this session, is Shweta Bhardwaj, who many of you already know. She's a very active member of APAC-Med in various of our committees. She's also the chair of our APAC-Med Digital Health India COE and is a health policy lead for J&J in India. Her responsibilities include developing and executing a strategy for further J&J enterprise-wide objectives and government affairs and policy platform priorities. And in this role, she works to advance universal healthcare coverage, shaping policy related to healthcare systems and reforms in India. She is actively involved in influencing health policy discourse externally through member trade associations, which include AdvaMed, APAC-Med, USIBC, and FICCI. Shweta is an MBA from the Institute of Rural Management, Anand, and MSc in Global Health and Public Policy from the University of Edinburgh. She was recognized for her outstanding leadership in global health by Stanford University during the Women Leaders in Global Health Conference in 2017. She has many publications in her name in national and international peer-reviewed journals and has presented posters and presentations in several global health conferences and events. So thank you, Shweta, for accepting this invite and joining us for this webinar. And finally, we have with us Roberta Sarno. Many of you already know her, interact with her very closely on a day-to-day basis. Roberta leads our digital health committee in APAC Med, where she supports the association's member to establish a digital health ecosystem, build knowledge, and advocate for optimal policies that help digital health innovation in APAC. Prior to joining APAC Med, Roberta worked as a senior consultant and business development manager at Alcimed in Paris and Marseille, France, where she supported clients in the healthcare sector on innovation and strategic projects. Before that, she worked as a generic engineer researcher at Curie Institute in collaboration with the French startup Meonix. She holds a PhD in genetics and is a Master's of Business Foundation in Sierra and lives in Singapore. So thank you very much, all the four speakers, for joining us today. There's a lot I know we need to cover up, and we need to keep some time at the end for questions as well. So without much ado, I'll hand the proceedings over to the session moderator, Shweta, to take it over.
Thanks, Anirudh. Well, it's a real pleasure for me to kick off our first knowledge series for our members as part of the Digital Health COE in India, and invite Roberta Sarno to share with us more about the APAC Med Digital Health Committee, its governance and structure, areas of work, and also highlight some of the ongoing projects as well as priorities for India. Roberta?
Thank you, Shweta. So first of all, I want to make sure, can you see my screen?
Yes, Roberta.
Great, okay. And you let me know if my slides don't move or if you cannot hear me correct. I'll try to make it smooth and short. I know we only have 10 minutes. Thanks for the introduction, Anirudh and Shweta. And let me tell you that I'm really excited and happy to be speaking here today. If I think about when we started this journey with the Digital Health Committee 1.5 years ago, and now we have a COE, a Country of Excellence in India, and we are able to share, it's really good progress for us. So let me tell you, I know there are more, there are a number of members who are participating to this webinar, but there are also people who might not be familiar with our activities in digital health. So let me tell you a bit more about this committee, this working group. So we started at the end of 2019, and today we have more than 75 individual members from 60 companies, roughly. I would say 2/3 are large multinational companies, and then we have also startups and SMEs who are, of course, very knowledgeable and active in the field of digital health across the APAC countries. So the group came together with two main objectives that you can see here on the slide. One was, I would say, really crucial and foundational, creating and sharing knowledge. And the second one is advocate for regional policies that can enable digital health in the region. So we focused for the first year on the first objective mainly, and it was not easy, to be honest, because digital health is up on the agenda of all the companies, all the organizations who are working in the medical device industry. But there is, it's a new topic, it's rapidly evolving, and now with COVID, it's even more the case. So even when we discuss about, the definition of digital health, we need to set the context. We need to start from the same page. So we started to do that last year. You see here on this slide, our board sponsor at APAC Med for this specific committee is Elizabeth Staudinger from Siemens Healthineers. And you also see 4, colorful squares are our key areas of work. We focus on these 4 areas because, as you might imagine, these are also the key priorities for our members. So cybersecurity, medical device interoperability, reimbursement of digital health solutions, and regulatory framework for new technologies. So these are our key areas of interest in the committee. And last part, I wanted to say that we cover 18 countries from a member perspective, which is huge, right? So mainly from APAC, but also we have very active members from Europe and the US who learn and share the knowledge with us. And now, since this year, since February, we launched some dedicated working groups in countries. So we currently have India, we have Australia, New Zealand, we have Korea, ASEAN, and China. So just a little bit of context about our work and why we came together as a group. And then, of course, feel free to leave some questions if you have in the chat, and I'm able to pick up on that later. So if you look at the blue box on this slide, of course, we will not go through all the solutions for sure, but here I just wanted to share with you what is digital health for us, for APAC Med, because as I mentioned earlier, there are so many different definitions of digital health. For us at APAC Med, digital health is everything that is facing patients. Okay, so you will see a number of solutions, patients facing solutions in healthcare. We started from some key trends, and if you look at some key trends, you will be familiar with that for sure. Longer life expectancy in our region, chronic diseases, increased cost of healthcare, lack of healthcare professionals, and empowered patients. All these trends, I would say needs, can be addressed by our member companies and more largely by all the stakeholders in the industry through digital health. And I think that's the reason why we wanted to set up this working group, this committee. And at the bottom of the slide, you can see a little bit more insights about the 4 key areas that I introduced earlier on. So cybersecurity, here we are looking with the members at everything that is supporting to prevent the risk of cyber attacks to connected medical devices. And it's even more important and crucial now during COVID. So what we do, objective of the committee is raising awareness, number 1, and then number 2, advocate for the creation of a harmonized framework across the countries. Then if I go to the second step, interoperability, here we are looking at everything that is enabling safe and effective sharing of data across the different digital health solutions or connected medical devices. Then from a regulatory perspective, we are looking very closely at how different countries regulate digital health. The observation is that there is no unique way to look at digital health from a regulatory approval perspective. And most of the time, these policies in place are not fit for purpose. So we are working as well in this area. And the last part, which is also one of the most critical, is reimbursement. And if I have to say it in one sentence, is the technology is there, but the key question that we have to answer is who is going to pay for these technologies, and that's we are working around policy recommendation to support affordability and to reach more patients in the region. So just a snapshot. I will not go through all these, but I just want to share with you, we have a number of resources that the committee published in the first year and a half of life. Everything is on our website. You can reach out to us. You can go on the website directly and download. We have here it's just the snapshot of the policy papers and some of the reports that we published with the group. And you will see some recurring keywords: regulation, reimbursement, value assessment, all the key areas that we prioritized. And then this is the work we are doing this year. So I said last year we focused mainly on building the foundation, and then this year we are bringing the content to the countries, to the stakeholders, and to the policymakers eventually. So 5 main areas. One is digital health regulatory. We have a policy paper that we are sharing now currently with ASEAN regulators. Second, that you see in red is our work around reimbursement and value assessment. And here, we have prioritized India. So we will start a number of initiatives around reimbursement in India. And then we have three more key areas that are cybersecurity, digital health ecosystem mapping in China, and health data. And I want to finish my presentation by giving you some insights about our current priorities and work in India. So in February, as I said, we launched this country centers of excellence, and we have one in India. Shweta, who is on the webinar today with us, is chairing this group together with Seema from ResMed. You see here a number of, some logos. These are some of the members of this working group dedicated to India. It's evolving, right? And you can still, if you are interested and if you want to join, you let us know. What I want to share and where I will end my presentation, we identified three main task forces or priorities. One is around enhancing knowledge and capacity building in the region when it comes to digital health. Second is building strategic partnership. And third is bringing our content from a regional perspective to a country perspective. So I will just mention one project here. There is the capacity building and advocacy work in the area of reimbursement. Is to give you an example, we will engage with key stakeholders, key deciders, and policymakers to work together around, topics like value assessment and reimbursement and coverage of digital health. And then, of course, we have other initiatives like this one, Knowledge Series. This is the first one. We will have more. And then our symposium that started in May, and we will have the second part, policy engagement, at the end of July, that we will, we will deep dive a bit more later on. So I think that's it from my side. Shweta, I don't know if you
Yeah, thanks a lot, Roberta. So thank you for sharing the overview of excellent work that APAC-Med regional committees have sort of already done in terms of, establishing the knowledge base in different areas of interest. Now, what are some of the challenges you foresee? I mean, that the country teams, the COEs that we've created this year might face with respect to actual policy shaping and dissemination with policymakers on the ground. So some thoughts around that, or maybe some lessons learned from other countries in APAC, which will be useful for us.
Yeah, definitely, Shweta. I think if I have to mention one key learning / challenge that we are seeing now is bringing our content from the region to the country. Because of course, our objective as a trade association is to harmonize and to have the same way to look at digital health across the countries. But then when we go and work in the country with policymakers and other stakeholders, we have to adapt, we have to know the market. So I think we are all learning about that. And the approach that we are using is always, we have our policy strategy. And then when we go to the country, we start to engage and discuss with key stakeholders to understand as well, because we need to adapt, right? So one example, the policy paper that we published on reimbursement is a good example, because we worked around two archetypes. One is Australia, mature market from a digital health perspective, and the other one is India. So our position at the end, the message is the same, but the actions that we can execute in two different countries need to be very specific.
Absolutely, absolutely. And the APAC region is extremely diverse, as we know it. So absolutely agree with you. Thank you so much, Roberta. So I'm now really pleased to invite Lalit to share with us the digital health landscape and reforms in India. And what are some of the implications that you foresee these reforms might have for the MedTech industry? So over to you, Lalit, for your presentation.
Thank you, Shweta. Let me get the presentation up. I hope my presentation is visible to all.
Yes, it is, Lalit. If you can put yeah, perfect.
So thank you very much, APAC-Med and Shweta, for having me here. It's my pleasure to share, a recent development that we are seeing in the Indian healthcare system, especially driven through digital health. And this is the right time actually to speak about it. All the time that we have is a very limited. We'll try to give the glimpse of it to the extent possible. But I think getting into the crux of the story, we have seen in the last few decades, the Indian health system has definitely worked both in terms of strengthening the Indian health system, creating new value chains, strengthening the private sector, medical devices, pharma sector, and all of this, has grown in its own maturity, doing what the bit is required. However, if you look at each of this, the core components or the islands of healthcare is what I call them. If you look at them today, they are well matured in each of their areas. Each of the island is looking great together. Pharma industry doing great, medical devices, private sector, and all of it. But the question that we're going to face in the future, and we have started beginning to witness that from the last few years, especially the COVID has exposed the cracks that exist in this fragmented healthcare system that we have today in India, is that how this islands of healthcare system that India has created will going forward connect together and create a strengthening of the health system that is required, and where all the value chain is put together and we create a futuristic health system which is conducive, futuristic, sustainable, and focused on overall well-being of every individual in the country, irrespective of rich or poor, public or private sector, or whatever in terms of it is. And in this, if you listen, there is a lessons that we have from the global world, and digital health has been playing a very big role in this entire connecting the dots that I say in healthcare system. We have lessons from other countries, and I think India has embarked on that journey, and we'll see digital health rocking the the health system in the next few years. And the journey has already begun. I think last few decades, government and the private sector embarked on the e-health and m-health journey. But I think in 2017, when the national policy was rolled out, there was a clear articulations of various key fundamental changes that we require to make in Indian health system, in which there was a lot of emphasis on the putting up a digital health reform and digital health as a backbone of the Indian healthcare delivery system, considering the constraint of resources that we had in India. And this gave the launch of National Digital Health Mission last year, and all those new development that we have seen, led by the COVID that we have seen, launch of COVID application, COVID India portal, Arogya Setu, and many more initiatives that will drive the healthcare system in the country. I think as an individual, as a stakeholders, and as a government, I think there's a larger acceptability that digital health is a very important element and as a mainstream healthcare system. And also the data is going to be very, very important in managing the health system and overall the population health management in the country of 1.3 billion population. And I think all these initiatives are going to drive the Indian health system in the coming years.
Lalit, there's a comment for you that one of the panelists is saying, if you can be a little louder, please. I think that would be helpful.
Sorry.
Come closer to the mic. Thanks.
And so if you look at the current health system that we have in India, you have hospitals, you have community care, you have primary care, you have public sector, private sector, and all of it. But as an individual today, we do not have a health record or a repository of medical records, neither of an individual or a family or a population as such, and that is, all because that we work in, or we are, availing a disintegrated or non-integrated healthcare system that we are. And there is a fundamental change that is embarked by National Digital Health Mission by putting up a national health UID to every individual and pushing towards a personal health record that will enable to, track every individual, have a health record as a repository for every individual, and that can enable us, both healthcare providers, policymakers, to assess and understand what is the future need of a population, and in terms of what will be the overall health system will look like, and plan the health system accordingly. So this is going to be a fundamental change that National Digital Health Mission is driving. Connecting the dots is going to be the base of this, and Health UID is going to play a very important role in this entire connecting the health system process. National Digital Health Mission intend to cover all the aspects of the care system, including hospitals, clinics, private sector, digital health provider, telemedicine providers, pharma, med devices, and all of those, which are very important in the overall health system delivery to the citizens and the patients. But the key fundamental things that are going to be driven through this is, yes, every individual, there is a need for having a health UID and providing a PHR to every individual. there is also need that you need to connect the dots between public, private sector, and across the stakeholders. There is a digital ecosystem that need to be driven. India, with 1.3 billion population, will never have enough number of doctors and number of beds, and the digital health will play very important role in bridging those resource gap that we have today. In going forward, we will not have those number of beds per thousand population, but eventually India will look at how many, how much time you take to connect to a doctor, or how much ICUs can be connected to a centralized ICU through any ICU network. All of this will enable through a digital health mission. And definitely digital health has the power to connect the continuum of the care. Important role in this, both in terms of the data that it provides, the insight it provides, and also the connectivity and bridging the resource gap that today exists in the Indian health system. And definitely once you have the good source of data and health profile, it will enable the policymaker to create a health system which is futuristic and apply the resources in a best possible way and create a health system that India requires. Now, if you see in overall, current scenario for medical devices in the current context, most of the medical devices either act as a commodity, whether it is a blood pressure machine or a blood sugar machine, or even a lab equipment or a CT scan machine, or a lot of other medical equipment. Most of these equipments are disconnected from the overall health system. Yes, their role is about to diagnose, provide the readings and the reports to the patient. This is on which the care system is delivered. But today, I think the role of medical devices is of prominent in this entire emerging value chain and the landscape that we will see through a digital health mission. The medical devices have power to uniquely position themselves and be closer to the patient, in terms of providing the right source of information, continuously monitoring the patient's health, either it is form of personal health devices, remote health monitoring, whether it is a diagnosis system. But I think the moment the medical devices start looking at connecting these medical devices to the overall health system. So for example, in most of the hospitals, you do not have your lab equipment connected to your hospital information system, or you do not have your eICU or an home healthcare services connected to your blood pressure machine, glucose monitoring, weighing machines, or a lot of other things that can be delivered at home. If this equipment are connected today, whether it is in ambulance, whether it is in a primary care, whether it is at the general practitioner level or at home, all of these medical devices are going to play a very important role in providing you the right source of information, timely information, and provide you an insight that enables you to deliver the care that is more insight driven and data driven, and that can help the medical devices to play a very important role. And hence, I believe that the medical devices companies have a very good opportunity in terms of creating a smart medical devices and connecting them in this entire value chain. And also this emerging trends due to the digital health overall in the healthcare system, there is increasing rise on demand of on-demand healthcare and smart consumers. Telemedicine, remote healthcare services is driving it, and all of this you do not have, actually patient will not have a time to go to diagnosis centers, avail the services. Hence, the smart medical devices will play a very important role, whether it is a personal devices or home devices or even connected devices at the hospital. And accordingly, if you get more insight and data, you will have evidence-based medicine coming onto them. And it plays very, very important role in what India has been trying. And, I think the vision is to move towards a value-based care model. This will be enabling a journey towards that, and medical devices can play a very important role. I think overall, if you talk about medical devices are well positioned not only to, provide an insight about the patient's health, but also use that information in creating a more evidence-based medicine and enable in a research which is specific to every individual, or I say, precision medicines and overall health management of a person. To close, I think emerging opportunities for medical devices, it's very important that how they utilize the information and the data that exists today. Many of the medical devices company have a platform or a software, or either for the hospitals or for the patient, that they utilize in terms of providing support, disease management, education, and training and capacity. But there is an increased opportunity for medical devices to go beyond and provide and create smart devices that will enable the providers, whether it is doctor, hospitals, or researchers, to provide the insights of an individual health and use that in more designing a more specific individual specific medicine and the treatment plan. And also leverage this information in predictive analytics and machine learning, so that your medical devices tomorrow can be more smart, maybe more intelligent in responding to the patient's need and help the patient to manage the overall disease management better. And hence, you will look into more of a smart devices in coming days. Definitely, the medical devices definition is expanding day by day. You have software as services, software as medical devices being added as a medical devices. No more the medical devices will be only the commodities that you see today, but it will expand. It will move towards MedTech and technology taking over. A lot of algorithms, artificial intelligence, and machine learning will form as a part of a medical devices, and hence those devices will, the definition will change, and so the medical device companies will have to respond and adopt some of those emerging trends. Yes, also today the medical devices limitations of providing the data and the diagnosis is very limited because of the commodity. But I think with the emerging e-health and remote monitoring system, telemedicine, this will expand radically, and medical devices will play a very important role in delivering the care in the remote areas and to the corners of the country. And lastly, yes, the medical devices will have to relook at the way they're engaging with the patient, healthcare providers, and also with the policymaker, that in this entire digital health journey, what is an important role that medical devices are going to play, especially around how do they safeguard the information that they collect, how they use that information that is created in the medical devices, and follow the various principles that has been laid as healthcare information providers or healthcare repository providers, and the data that medical devices capture, how it can be utilized in the benefits of the patient and the policymaker and overall research aspect. So there is an opportunity there, and I think the earlier medical device companies engage with the government in this entire process when the policy is in initial stage. I think it can be very important for the entire industry to get acknowledged and be an integral part of this entire national digital health mission. Having said that, I close my presentation here. Happy to have any questions that you may have.
So we do have a couple of questions which I will go to perhaps in the Q&A, but I am really curious to ask you one question, Lalit. I know that you work very closely with the National Health Agency, which is tasked to implement the National Digital Health Mission in the country. In your view, what are the areas of collaboration which the government really foresees with the private sector? And particularly if you can talk about medical device industry in its journey or in successful rollout of the National Digital Health Mission in the country. If you can share your thoughts on that.
I think as National Digital Health Mission is being rolled out in some of the union territories, and now there is a plan to launch across the states. The initial thought is about how do you onboard the existing providers, both public and private sectors and digital health providers. However, there is a very limited, articulation of how the medical devices will play a very important role in this National Digital Health Mission. If you look at either it is a digital health blueprint or whether it is even the strategy that has been rolled out. But however, if you look at the emerging healthcare new care providers like digital health providers, remote healthcare providers, digital health platforms, all of that care which is provided through a digital or through a connected hospital will not be possible if you do not have a connected medical devices in a hospital. You cannot have a connected hospital if you do not have a connected medical devices in this. Okay, so although it does not articulate clearly in this National Digital Health Blueprint, but I believe that the connected hospital, the connected care, the connected delivery system will not emerge without having the medical devices being an integral part of it. I think there is very important opportunity for medical devices to connect with the government, do some POCs and establish that how important it is to have a connected hospitals and a connected medical devices as a part of it, and encourage government to move towards that and pick up some pilots and implement some of these solutions and showcase that how the connected ecosystem can enable in delivering a better care system. And this includes lab equipments in devices in the emergency and the casualty, EICU and ICU and various other areas. If you bring that connected setup, I'm sure it has a value creation in both public and private sector. So I guess there is an opportunity, but I think NDHM is largely focusing right now on onboarding public and private sector.
Absolutely. I think we are in the year one of implementation, and right now they're really particularly looking at setting up the guidelines and the infrastructure in place. Thank you so much, Lalit, for sharing your thoughts and insights. I would now call upon Dr. Pankaj from Access Health to share with us, his thoughts on what are the newer opportunities of engagement and partnerships that he sees, for the medtech industry, given the emerging and very dynamic digital ecosystem that we are seeing. So over to you, Dr. Pankaj.
Thank you, Shweta. Um, I have shared my slide deck. Let me see if I can put it into the presentation
Yes,
mode.
yes, it
Yes.
is. Thank you.
Okay. All right. So thank you for having me on this forum. It is really a pleasure to talk to everybody and share my thoughts as far as the National Digital Health Blueprint and the National Digital Health ecosystem that is emerging, and how it is going to create completely new set of opportunities for medtech. So that's going to be the focus area for what I'm going to say. Um, Most of this slide has already been covered by Lalit, so I'm not going to go over it all over again. However, I'll take the liberty of talking 2 points. One, I have been part of this journey from 2011 onwards. So I had the pleasure of writing the public health IT study report with NHSRC in 2011. Then I was leading the task force that wrote the metadata standards in 2013. And then, the red box that you see on the extreme right is where Access Health Digital has played a vital role working as an NGO to support the National Digital Health Blueprint and the emerging National Digital Health ecosystem. The latest announcement being the unified health interfaces, and we played a vital role in defining something called e-objects. These are the interfaces, standard interfaces that will interface between primary, secondary, tertiary, and from the provider to the payer. So that's been our work in the last about 3 years. To take the thought a little forward, all of us know about the market diversity. We know that India is a very diverse country, but the population of India and the health infrastructure, it's like an inverted triangle. So the health infrastructure doesn't even reach the bottom of the pyramid of the health population. What do we do about it? I think what is happening is, if you were to go to a village, and this is my favorite quote, I've said that in many places. If I was to go to the interiors of the country, I'm able to find a Coke and a condom, but I'm not able to find a paracetamol. So there is definitely a issue there in terms of healthcare infrastructure hasn't got the numbers right, hasn't got the supply chain and the penetration right. Because if Coke can reach there, so can paracetamol, so can doctors. So what are we doing in this? So as Access Health Digital, what we are saying is we are helping the bazaar model to emerge. We run an accelerator program. We have 40 plus startups, health tech and medtech startups working with us to implement the software as a service model. We are also very closely working with Amazon, so the AWS, to create the IaaS, which is infrastructure as a service, platform as a service, and take it forward so that it can go to the bottom of the pyramid. All these guys, these startups, are the ones who will be able to take it to the last mile and implement it at the doctor's clinic, at the patient's home. So there's a huge opportunity for the medtech to put the devices in the pocket of the doctor and the patient. The bazaar is anyway emerging. What we are doing is we are trying to bring the retail and the telecom giants to play a role in healthcare. Here are some of the leaders. If I missed out some of the leaders, please don't sort of raise a voice on that, because these are just representative names. What I wanted to convey was that if you look at the top right-hand corner, these are the new entrants, and they are shaking up the apple cart. They're challenging the old guard. And there is a fear, and it's a very real fear. What happened to mobile and what mobile did to the camera and the film industry is likely to happen to medtech. And it's a very real fear. We have to wake up and take notice of it. These guys are going to eat away into the market share. And if we are not really cognizant, it may be too late. So that's the point I wanted to convey on this slide. A lot is happening. The lines are beginning to blur between GGB, what used to be genetic genomics and bioinformatics. Long time ago, when I worked on the Human Genome Project, bioinformatics was separate, genetic was separate, genomics was separate. No longer. Now you get degrees from universities, which are GGB degrees. Then you have the social media, mobile analytics, and cloud. You have artificial intelligence completely replacing analytics now. You have IoT becoming IoT, Internet of Medical Things. You have health tech, MedTech, and drugs. So the lines between these are blurring to an extent that, you really can't find that, whether this is purely a device, whether this is purely a drug, whether this is purely a software. So all that is gone. That's a history. So we are living in very interesting times when, you swallow a pill and that has software built into it. It has a device built into it. So, these are very, very interesting times that we are living in. How is all this going to happen now, and what is the government of India doing about it? What are the levers of change that are emerging? So there are three levers of change. One, it is what we call as the financial lever. The health claim platform and a unified health interface is emerging from a policy perspective. I'll talk a little bit about it in subsequent slides. But then, the financial lever is what will change or will force the market to change and bring the standardized data. Right now, everything is in silos. But unless there is money on the table, people don't change. And I'll tell what that financial lever we envisage, at least we are able to foresee. The second one is an epidemiological data as a lever. When I talked about this lever about 3 years back, people said, yeah, maybe. But today, nobody says that. Having the pandemic, been there for a year and not going away, nobody ever sort of, in all my meetings with the government and the private sector, nobody has challenged that epidemiological lever is an important lever. So now everybody understands what that means. E-governance, everybody has known that e-governance will be a lever, but it has assumed a completely new proportion in the pandemic. And I'll talk about that in a bit. So first about the financial lever. So what has happened is, because of the change in Ayushman Bharat, because, so much of coverage of health insurance that is going to happen, before Ayushman Bharat came in and before the consolidation in the health insurance happened, health insurance sector was a very small sector in India, less than 3% in the private sector. Some government insurance schemes about 10%. But now with all the changes and consolidation, we are likely to cross 55% of India's population. Now, when we cross 55% of India's population, then it turns into a monopsony. So when the health insurance says, give the e-claim to me in a standard format, if you want your money tomorrow, then the industry begins to take notice, says that, okay, if you're going to give me the money tomorrow, and if I have to give you the claim in a standard format, what do I have to do? So I had a lot of interactions with CXOs, hospital CXOs. I myself have been a CIO of a large hospital chain in the past. So most of them are my friends. So I went and asked them, guys, what do you think? So some of them said, our claims are stuck anything between 20 days to 20 months. So that is working capital stuck. There was one CEO and a founder of a hospital, and I took his permission to quote him, Shuchin Bajaj from Cygnus, and he said 43 crores is pending in claims for the last so many years. And I was like, oh my God, if that is the amount of money that is pending, I mean, if I can reduce that time from months to a couple of days, will it be okay? He said, I'm going to cut off my right hand and give it to you. So that was the comment. And I was like, oh my God. So this is a change which the industry has been waiting for, and it is here. NDHB, the National Digital Health Blueprint, has made it happen. So very soon, the insurance sector is going to roll out a standard e-claim format. We've been working very closely with the government on that. And it is going to ask the provider sector that give me the claim in a standard format on the NDHB format standards. So the e-discharge object will come out instead of a standard e-discharge summary, which is a sort of a PDF or a paper. Now it's a machine readable. So it is based on standards, and an e-bill comes out, you bundle it together, and an e-claim object happens. And then the e-claim object is carried forward for adjudication. So your money depends on it. Now, if your money depends on it, obviously people are going to turn around and say, all right, I'm willing to do so many things for standardization. So gone are the days when you could actually have MedTech devices producing reports which are sitting there and not really getting integrated into the HIS and the EMR. Now, for the e-claim, you will have to attach it in machine readable format. And this is a huge change which is coming in. Taking it forward in terms of epidemiological lever, we are failing in the pandemic in many ways because the data that is coming in is in silos. We are not able to analyze it. Had it been in the standard format, we would have been able to, sort of do it near real time. Today, that is not the case. We are not able to produce heat maps. We are not able to find exactly what are the hotspots. So whatever the things are being done by the government, commendable job is being done, but it is all on Excel sheets and paper. Now that delays the process. There is a lot of humongous number of manpower that is required to make it happen. Now that can be automated, it can be more precise, and intervention can be better. We've learned the lesson on the e-governance also. So, the supply chain and the interventions have to be made in a way, just like Lalit said, the registries and the identifiers are the key. NDHB has already said it, NDHM is working on it. Unless we have all the doctor registry, the facility registry, the beneficiary registry, and all that in place, and the unique identifiers in place, we will not be able to do justice on the supply chain. We will not be able to bring oxygen, beds, drugs to where it is required. And we've faced it in this pandemic. We've had this discussion with the government. We've had this discussion with the task force. We've said, unless you have the registries in place, you're not going to be able to do this. A level playing field is emerging. Gone are the days when you had public sector and private sector. Now it's going to be a single national digital health ecosystem. The last mile will have to be played by self-help groups and NGOs. They will have to be brought in to run telemedicine programs at the last mile. So A&M and ASHA has become a very vital component of your entire last mile delivery. And also the primary care healthcare providers, whether they are MBBS or whether they are semi-qualified other health professionals, which are in rural India or semi-urban India in the private sector, they all get integrated into this ecosystem. We are also talking to many of the agencies in the government and in the private sector to bring NBFC, to bring post office, railways, and many other organizations together to see how this ecosystem can be enabled so that we can take it forward. Last but not the least, Lalit also mentioned, and a couple of my other co-panelists mentioned SAMD, software as a medical device as a drug, mobile as a medical device. Now, these are overlaps that are not there in the governance parlance as of today. So as a medtech industry, as health tech industry, we have to get together to help the government frame rules so that this parlance has to be brought in into governance, and not just into governance, the governed also actually get the benefit of it. The ecosystem is emerging, and I would sort of put it as a call to action that it is very important that we engage with the ecosystem to make sure that the entire paradigm of drug and software and device is sort of taken together and not in silos. I will stop at that. Those are my contact details. Thank you very much.
Thank you so much. Thank you so much, Dr. Pankaj, for sharing such amazing insights in the work that you and your team are doing at Access Health for really kind of advancing the digital health journey and being part of a very big mission with the government. So we can have all the three speakers now. Roberta, I can't see you. So I have many questions, very interesting questions coming up. What I'll do is I'll perhaps pick few and then direct them to the speaker that I think will be able to best answer them. So for you, Dr. Pankaj, I have my colleague Rishi, who's asking that, whereas we have evidence that digital health, will disrupt healthcare delivery and, connect patients across the continuum of care. Can you share some insights on how the digital health is also likely to change the way, business, or we can say not perhaps business models will evolve within the medtech industry? So how do you think the evolving digital health ecosystem will uh, require medical devices to change their business models in the future?
Sure. Thanks. It's a very important question. In fact, it's actually inevitable that the business model is going to change. It is going to change because of a couple of reasons. One is the policy, which is sort of bringing a level playing field to digital health. MedTech being an integral part of this entire ecosystem that is emerging. So gone are the days when you could actually sell a standalone device. So you can't do that any longer. You will have to bring in devices which are completely connected to the ecosystem. The second thing is you're also being challenged by the new entrants, which are, the FANG. It's not my sort of an acronym, but the Wall Street calls them FANG. So these are the Facebook, Apple, Netflix, Google, and Amazon. So these guys are coming and challenging the old guard. They are bringing completely new set of medtech devices, which are wearables, and they have the power or the computing power which was earlier available only in large devices. So now they are also bringing it at a cost or a price point which is unimaginable. So anybody can afford it and put it on their wrist, or anybody can use it. So the times are approaching when you will have to shift from a capex model to an opex model for large enterprise. And when you are going and selling it on a B2B2C or a B2C model, which you probably never did before, you will have to come out with price points and models where you are doing disease management and you're selling the entire disease management paradigm rather than you're trying to sell a device. So nobody's going to buy actually a device from you. You're going to buy an entire disease management paradigm. So if somebody comes and says that, I will make sure that your HbA1c remains below 7, and I know one company, I'm not going to quote them here just so that I'm not seen to be promoting them, but there is a startup that works with us, and their business model is that, they go and tell the patient, I'm going to keep your HbA1c below 6. And they go and tell the insurance company, you pay us only if we are able to keep it below 6. Otherwise, you don't pay us.
No,
Imagine that's a disruptive model, completely disruptive model.
Absolutely. So that's where we are saying that it's going to change the medical device industry, completely change into medtech industry.
Yeah.
And really sort of, giving patients, first of all, reaching them where they are, and then giving them, like you said, an entire disease management across the continuum of care is what we see as an emerging trend. Okay, next question is for Lalit. Lalit, I know you were working very closely with the National Digital Health Mission. So one of my colleagues from Medtronic, Debakar, is asking that if you can share with us, what's the progress? We are hearing that some of the state governments have really announced, rolling out of health cards. We know that there were a few pilots that were done in union territories and other states are following. So can you share some lights? We also recently read a news article which said 12 lakhs, health IDs have been generated. So if you can just let us more about what's really happening right now, how many states are really now moving on this generating health IDs for the citizens at large?
Sure. So, Shraddha, as we had mentioned, National Digital Health Mission is a pretty large program and involves multiple building blocks. And I think what, as a baby step towards the implementation, was to pilot it out in some of the union territories and to understand both in terms of its workability, required infrastructure and resources, and see what were the challenges and bring that learning into building the larger ecosystem that technology platforms and other things were required. I think NDHM has passed that journey. They had their proof of concept developed, They are almost in the closure of developing the technology platform that enables them to issue the health UID. ID, I won't say health UID card. These are two separate things. So as of now, and it was very much successfully piloted out in COVID app, where every patient who is applying for a vaccination and he is willing to use his Aadhaar card was promoted to generate a health UID, and we saw that 12 lakh plus beneficiaries availed that service. So you have those things in place, which was further integrated with the DG Locker. So you had a kind of a integrated system where you would have those digital certificate aligned to your UID card or UID number, for which you could further expand it, and you can keep expanding and link your other health records and other aspects, which leveraging right now as a health DG Locker. But going forward, I don't think the government has intent or plan to roll out an issue of physical cards to every beneficiary. It's more about is generating a virtual card or virtual health UID, for every individual who intends, and it's voluntarily as of now today, is to avail that and start using it. And the opportunity exists for an individual to link either public or private sector personal health records in that through UID and keep building that out. And hopefully we'll see this UID platform now being expanded to multiple other public health programs, and also to the private sector, that here is an ecosystem that is now open. You already have a sandbox where you can pilot it out your EMR or PHR that you have, test it out, try your APIs through the system, and it can be rolled out across the country very soon, I think. Right. And we are not away. I think in a month or two, we'll see that happening, and both public and private sector started engaging and using that UID generation process.
Yeah, sure. Thanks. I have next question, not really in any order, but perhaps for Roberta. Roberta, I have a colleague, Ayush Kaushal, who is asking about if you can share some light on how the reimbursement really happens for, say, remote monitoring service or devices. Your thoughts on that, Roberta?
Yeah, sure. Thanks, Shweta. I'm not surprised that there are, there is interest around reimbursement, because it's really the way we can bring these new solutions to patients. So it's to be honest, it's a topic that we explored from many different angles, and maybe I can share. And let me go straight to the point. I don't have the answer, right? So I don't know how reimbursement will happen. It will depend on many different factors, and also on the healthcare system and the country as well. So it's really hard to give one unique answer. But what I can say is that there are a number of examples that we know, that we studied, and we wrote some reports to extract some best practices, so we can learn from some good examples from our region, right? So there are some companies that manage to get their digital health solutions and remote care monitoring solutions reimbursed. There are not many, but there are. We built an entire curriculum around that. We organized a symposium in May, trying to learn from these successful use cases. So we have a couple from our member companies as well. Now we are moving to a kind of harmonization of all the learning we have. So the point is, we don't want to make these successful cases just isolated, but we want to build a framework for policymakers to look always at this in the same time and in the same way at digital health. We have some reports that I can share for sure, and I can provide more insights. But yeah, ideally, I think it's the way it will happen is by building capabilities together with all the stakeholders involved, by having a dialogue with them, trying to understand how they can assess the value of digital health, and basically what are the requirements that they have in front of the manufacturers as well, because this is not clear. So if there is no clear guidance, then it's really hard to get something reimbursed. So yeah, I think that's the perspective I would like to share. And then I'm happy to provide some more resources as well on the work we did.
Absolutely, absolutely. And we will take it up as part of our task force as well. So just want to check with Anirudh. Anirudh, how much time do you think we have? Because I think we're just about at the close. And I know we have a lot of questions unanswered. Perhaps the Secretariat can arrange to sort of answer them through our experts and send it across to the Digital Health Committee members. So Anirudh, I think we are just about on time, and I would like to pass on the baton to you now for the closing. Thank you.
Sure. Yeah, thanks, Shweta. And I actually wish we had budgeted a little bit more time for today's session. I think there are some very good questions I can see on the chat window. Unfortunately, we don't have time to answer them right now. But I promise you that we'll collect all this and we'll share it with both with all the panelists today, and we'll get you the answers as soon as possible. I hope Pankaj, Lalit, Robert, you would be able to help us in sharing your perspective on those questions, and also, if possible, share your decks, even though if it's not this one, but if there's an abridged version that you'd like to share with the participants, because I am getting some messages saying that the slides are very interesting and very relevant. So it'll be great if we can share that. So thank you all. I think we had a good number of people who attended today, and I saw that we started with 75 and we ended with 75. So it shows that the people were engaged. A lot of questions coming in.
Wow.
The session was very informative. I myself personally, learned a lot, and I hope all of you were able to take back some learnings from today's session. As I had mentioned in the earlier in my opening, and what Shweta also mentioned, this is the first of our series of digital health, knowledge sessions. We'll be having more of these as we go along. It'll be great actually to hear from all of you and get some feedback from you as to what are the topics you would like us to cover, so that we can bring them to you. Till then, thank you all. Stay safe, be healthy. Thank you, Pankaj, Lalit, Roberta, and Shweta. I think it was an excellent session, and we'll definitely be in touch. So thank you once again.
Thank you all.
Bye, everyone.
Bye.